Hello again, and welcome to another 5 minutes with my co-host, Dr. Phyllis Murphie. My name is Adrian, and we're delighted. Thank you, Phyllis. We're delighted to be joined today by Dr. David Garley. David, introduce yourself, sir.
Hello, Ben. Thanks for having me on. So my name's David. I am a GP based down in Bristol. I'm also director of the Better Sleep Clinic, so you see a range of different sleep disorders online. And I originally, so in sleep-wise, originally started working in sleep in respiratory. So I used to be a respiratory registrar. So I was dealing a lot more with things like obstructive sleep apnea. But now we work with a broader range of sleep disorders.
Makes sense. So yeah, so your active presence on LinkedIn. So yeah, do you find, just curious, do you find it actually generates business? Just interest?
Yeah, I think so. So from my own clinic, I mean, we want to see patients, but also a lot into awareness. So a big thing with sleep is that if you look online, there's not an awful lot of evidence-based content. So one of the big aims of our clinic is actually to educate and do awareness. So it does fulfill those criteria. Yeah, we do get people getting in touch, looking for workshops, and yeah, some of the biggest work we've done has actually come via LinkedIn. So it can be quite a helpful way to get in touch with people in that respect.
Do you find, David, that the long waiting times for the NHS, people are actually more willing to actually seek different routes now to get therapy and get diagnoses? Is that something that you've came across?
Yeah, we definitely do. But also a lot of workplaces now have medical insurance or medical policies through there. So actually going through work can be quite a legitimate way of sourcing access to healthcare, particularly with sleep, which, as you know, I mean, the waiting times in the NHS, they vary a lot across the UK, but they're hefty.
Yeah.
And probably only going to get worse. So I'm just going to bring you back to your LinkedIn campaign and caffeine. I loved it. So, and you sent me a bag of the coffee through, and it was good. So,
do you like it?
Yeah, play with it. Tell me some more about caffeine or coffee and sleep. We've got a few minutes. What's the angle?
So I think the big thing, so with all sleep content, it sometimes just gets presented in this kind of black and white way. When so little of sleep is black and white like that. A lot of it is how it affects you as an individual, and trying to kind of get that point across. Getting people to have to be a bit more critical in what they think about sleep, what they hear about sleep. And so we wanted to use coffee as a springboard for that. So is coffee bad for sleep? It's not really that. It's got a slightly more nuanced relationship. So we think that sleep and coffee both promote wakefulness. So in that sense, they're very much on the same side. But it's also about not having too fixed a view of sleep. And with insomnia, one of the perpetuating factors is that kind of rigid pursuit of perfect sleep, and actually trying to loosen that grip, thinking, well, even if I had a coffee, even if I had it in the afternoon, even if it did make me stay awake for a bit longer, like, is it going to be that bad? And this whole interaction with sleep effort, I think sleep effort is quite a difficult concept to get over the net, partly because sleep in itself isn't really a concrete concept. Like, what's sleep? So what's trying to sleep? What's not trying to sleep? Like, they're all a bit abstract. And so we were hoping that coffee might be a way to kind of unlock that idea for some people. It's certainly stimulated conversations, and it's been picked up in quite a few media settings, which is what we really wanted.
So it raises awareness, which nicely segues into the Awake Check. I mean, that's the mission that they're doing here. What are your thoughts? I mean, you're aware of what we did. We have the stop bang for sleep apnea. We have the insomnia severity index for insomnia symptoms, and then optionally the functional outcomes of sleep questionnaire, if you choose to do a follow-up one. Thoughts?
So, I mean, I think it's really great to get more data on this subject. So sleep is an enormous problem. There's a huge volume of sleep disorders in the community, and the vast majority don't present to healthcare. So trying to get more information on that can only help. Knowledge is power, and when you understand more about the situation, then you can be a bit more focused in how you deal with it. And we often quote 10% for insomnia, and then sleep apnea, that 85% are undiagnosed. But those statistics have been knocking around for a long time. So trying to get more up-to-date data on that, I think, is helpful, particularly now when the whole healthcare landscape is changing. understanding a bit more about the extent of the problem, I think, is helpful, and particularly with something like sleep, where so much of it does go under the radar. People don't talk about sleep. People just think it is normal, particularly sleep apnea. You know, all of the symptoms happen at night, or a lot of the symptoms happen at night. So, you know, as they creep in, you know, all the daytime symptoms you get in terms of fatigue, poor concentration, memory, low mood, people just think that that's their lot in life, but actually it's a disorder that's crept in over time. And so trying to find ways to understand more about the prevalence of this issue and address it more in a more focused manner can only be good.
We've certainly tried to focus down on using the social media to attract people to actually take the awake check, and we're up to 1,090 from this morning. We're actually ahead of target in terms of recruitment, so we're quite excited about that and hoping to get to that 5,000 participants by the end of April if we can, which would allow us to perhaps use the word prevalence in our statistical analysis.
We'll try to get there. Okay, on that note, let's wind it up and say thank you very much, Dr. David Garley, and really do appreciate it. Taking 5 minutes with.